Okay, hi, my name is Lainy Thomas, and I'm a junior here at Frisco High School. This is my first year in the ISM program, and I'm studying orthopedic surgery and sports medicine. In the fall of 2016, I'll be attending USC, and I'll also be playing beach volleyball there. Sports have always been like a big part of my life, which is why I think was interested in studying this subject, because I can feel like I can relate to other athletes who are going through injuries, and I really would love to help them through that. My quote is, "We are at our very best and we are happiest when we are fully engaged in work we enjoy on the journey towards the goal we've established for ourselves. It gives meaning to our time off and comfort to our sleep. It makes everything else worthwhile." Earl Nightingale. I feel like I can really relate to this quote because this area of study is something that I'm really interested in, and if I wasn't, then I feel like I shouldn't be pursuing this. Just some background. The field of orthopedic surgery consists of injuries involving the musculoskeletal system, which includes like bones, joints, ligaments, tendons. Orthopedic surgeons will prevent, diagnose, and treat injuries. Sports medicine is a subspecialty of orthopedics that deals with athletes' physical fitness and the treatment and prevention of injuries. There are multiple subspecialties within orthopedic surgery, but this one really spoke out to me because I feel like I can relate very well to this. Research. One topic that I researched was ACL injuries, and the ACL stabilizes the knee when pivoting and twisting. So often you'll see people have an ACL injury while playing sports like basketball or soccer or volleyball. It's a very common injury, but yet it takes a really long time to recover from. I also looked into why ACL tears can be more common in women, and that's because estrogen receptor sites increase collagen content in the knee, so they're more prone to having an ACL injury. I also did research on arthroscopic hip surgery. Arthroscopy is a minimally invasive surgical procedure where an arthroscope is inserted into the joint through a small incision. So basically this allows for less invasive procedures and less time afterwards to recover from this. My mentor specializes in these types of surgeries, so hopefully I'll be able to get to see one soon. But yes, these are becoming more common with orthopedic surgeons just because people are demanding that they get back to full function quicker. I also researched more about sports medicine when I first decided that this was going to be my topic. Many surgeons who specialize in sports medicine work with sports teams ranging from the high school to professional level. So you'll often see orthopedic surgeons who specialize in this area. They also can be trainers for professional or high school teams, and they help athletes through injuries, and they help them to gain back full function as quick as possible. So for my interviews, my first interview was with Dr. Catherine Coyner. She is an orthopedic surgeon specialized in sports medicine. She works at UT Southwestern. She was a college athlete, and also many of her patients are athletes. And this interview just really taught me how orthopedic surgeons often have a background in sports, and I feel like that's something that I can relate to, which is why I'm really interested in this topic. And she was also a team physician at Duke University, so she had much experience within the sports area. My second interview was with Dr. Shane Miller. He's a pediatric sports medicine physician, so he's not a surgeon, he's just a physician. He often sees unique cases with children because you don't want to injure the growth plates, causing them to have potential problems in the future. He also teaches students in the clinic, and he creates research and treatment plans for injuries. Something interesting that he told me was that sports medicine is definitely a team event because you work with other physicians to help create the best treatment plan for patients, and often there'll be times where you don't know what the best route is to go, so they are able to help you through that. My next interview was with Dr. Don Buford. He is not affiliated with the hospital, so he has his own private practice. It was interesting to learn about that because more people are leaning more towards being affiliated with the hospital just due to the downside that they have to fill out all the paperwork, whereas if you work at a hospital, they will do that all for you. Although some benefits to it was that he got to determine his own work hours and which types of surgeries he wanted to perform and how many a day, so things like that. He played professional baseball for the Baltimore Orioles, so he also had a background in sports, and he specializes in minimally invasive shoulder and knee surgery, and these procedures are becoming more common just due to the fact that you can recover quicker from these surgeries. My next interview is with Dr. Stephen Michelson. He was a previous mentor for an ISM student last year, so he knew what the ISM program was all about. He is a general orthopedic surgeon, and he often sees very diverse work days. Sometimes he'll be working in the ER, and other days he'll just be consulting with the patient, and the amount of surgeries that he performs a day also differs. He switched from trauma surgery to orthopedic surgery in medical school. While in medical school, you get to experience each area of the medical field, and once he started learning more about orthopedic surgery, he just loved this area and he decided to pursue that in the future. So my mentor is Dr. William Robertson, who was my next interview. He is an orthopedic surgeon who specializes in sports medicine at UT Southwestern. He's also the team physician for the Dallas Stars, so I was able to incorporate that into my original work project. He played football in college at Yale, and he had a big background in sports also. Something that I really enjoyed about him was just his work ethic and how he was telling me that you have to put a lot of time into something if you want to accomplish something big. So for my original work, I gathered data for the Dallas Stars with help from my mentor. My original work mainly deals with the sports medicine side of things and potential injuries that hockey players could possibly face. We did 3 different tests, which include the balance test, the functional movement screen, or FMS test, and a hip range of motion test. So I did some more research on what these 3 tests can conclude. So the first one is a balance test, and in the image on the screen, that's what the balance machine looks like. And basically there's 4 parts to the test. You can stand on your right leg with your eyes open, right leg with your eyes closed, and then left leg, eyes open and closed. It will score you on a sway index, which is how far away you move from equilibrium. So the higher the score you get, the worse you do. If you get a high score, you will be able to know which area that you need to work on for balance. And this is really important with hockey players since they have to skate while playing their sport. The next test was the functional movement screen. This is a series of 7 different exercises or movements, which include deep squat, inline lunge, hurdle lunge, shoulder mobility, active straight leg raise, stability push-up, and rotary stability. You are scored from 0 to 3 for each of these different exercises, 3 being the best, 0 being that you couldn't perform it. Asymmetries are also noted, so if there's a difference between the right leg versus the left leg, that's something that trainers would want to look into. You add your scores for each portion of the functional movement screen test to determine an overall score. If your score is 14 or less, you are 11 times more likely to sustain an injury. So this test really provides doctors with information telling them how prone athletes are to be having an injury. The FMS system will also link corrective exercises to the test, so you'll be able to mechanically restore movement patterns that aren't very common. In my testing for my original work, we took out shoulder mobility and trunk stability due to the fact that we were focusing more on the lower extremities, which is from like the waist down, so we were focusing on hip range of motion as well as functional movement screen. The third test was the hip range of motion. So we did 6 different tests, which include hip abduction, adduction, internal rotation, external rotation, extension, and flexion. So abduction is the degree at which the hip moves away from the central axis of the body, while adduction is the opposite of that. Hip extension is when you fully extend your leg, and then hip flexion is when you pull your knee into your chest. And then, so these tests will help show hip movement abilities of athletes and potential limits that they might have. So through this original work, I was able to see how these 3 tests can correlate with one another and how it can show possible injuries that athletes might face. This is just a little part of the data that I collected. So we have all the players on the left side and then the 3 tests. I have a copy of this right here if you want to pass this around just to see. We have 56 total players. We don't have all the data for each player, but you can still use them to compare data with one another. We have 26 players who have all of the data, so we be able to compare the balance data with the functional movement screen and also the hip range of motion. For my final product, I will be using this data that I've collected and be working with the UT Southwestern statistician to determine correlations within the data, so we can determine if the functional movement screen, or a low score on the functional movement screen, predicted low hip range of motion, which could ultimately tell you that an athlete may be more prone to have an injury. Also develop a manuscript that explains methods, materials, procedures, and then the conclusion. And I will create a research board, which is very similar to what medical students do when they come up with a study. So I'll be able to get real-world experience with that, and possibly that might be something that I will have to do in the future. And then I hope to apply this to the real world, so hopefully other professionals in the field of sports medicine could use this information to help prevent hockey players from sustaining injuries. So overall, I gained a lot of knowledge through my original work project and all the interviews and research that I've conducted. I hope to continue learning as I create my final product, which relates to my original work. ISM has taught me valuable information, and I'll be able to use this throughout my future. And thank you for your time.